Okay. Okay, and also let me share with my screen in order to. Okay. Can you see my screen?
Yes, sir.
Okay. First of all, let me ask you if you have another experience with the Kamolo system in another study. I don't know exactly if your hospital participate in some of the another trial or research.
Yes, sir. Action 3 is going on.
Okay, with Action 3 is the
Yes, sir.
trial. Okay, fantastic. So practically the functionality of the system for Action 3 and Reach trial are practically identical. So this is a good point to facilitate the understanding. Okay. The first issue that we would like to discuss with you in this training is about the generic flow chart in relation to the data management process. As you can see in the screen, there are the different entities involved in the data management process and also different activities that your team it will be involved. There are some differences between Action 3 system and the version of Kamolo system for Reach trial. So, but practically the functionality are identical. This is a very, very good point. As you can see, there are three entities: the WHO organization that is the sponsor, the CRO involved in this trial, and also our entity CREP located in Argentina that will be in charge of the data management process. The first activity are related with the data collection of the data. Remember that for Reach trial, there are a set of worksheets that will be collected information and also will part of the medical record. And this worksheet for our study is a set of different forms that collect information, specific information in each stage of the trial. And then this data will be entered in Kamolo system in an identical way that Action 3 trial. And as soon as the data is entered in the system, different kind of message and data consistency detection are implemented in the system in order to alert to the data operator about some data discrepancy or data mistake in the data entry. Welcome to this new member of this meeting. We have started with the generic flow chart. The third point is related with the data validation. As we have mentioned, the data validation in Kamolo system is implemented during data entry process, but also you can use different kind of reports available in the system in order to visualize in different way about the data inconsistency pending to be solved. And later of the data entry is validated, and all the worksheets are already entered in the system. The different monitoring activity will be implemented by the CRO through the source document verification process. That basically this activity is the comparison of the data between the worksheet of the study against the data entered in Kamolo system, and this source document verification process will generate different kind of alerts in order to indicate different kind of problem that then we will discuss later. And finally, the last step corresponding to the database looking. That in our case, for each trial, for each participant that's finalized the participating in the trial, after the data entry, data validation, and so does the corresponding source document verification, in combination with CREP, CREP, the CRO, and your team, will we close patient by patient and block patient by patient in order to indicate that this participant has no pending issue in terms of data management process. So this is the generic flow chart. Maybe some adaptation can be implemented for some particularity of the hospital, but please let me know any doubts or comment about this.
Daniel, good morning. Yeah. Good morning, it's Thanos. Just 1 minute. I would like to introduce myself and say hello to the team. I'm not sure if you can. I have opened my camera, but I'm not sure you can see me. I'm the clinical lead for this study, and I would like to thank you for accepting our CRA, Kamal, for the site initiation visit. I think now you can see me. Hello.
Yeah.
On 22nd of November. And we are almost ready to activate your site for the first screening. So as soon as we collect all the pieces, and this EDC training, of course, is a very important step before activating the site. And thank you, Daniel, for waking up so early. For you in Argentina, it's so early in the morning. And I will not stay for this call, for this training, because I have watched it a couple of times. But I just wanted to say hello and thank you.
Okay, thank you, Thanos.
Okay. Have a nice training and have a nice day and afternoon.
Okay, thank you.
Bye-bye. Bye-bye.
Okay, continue with the next part of the training. Please let me know if you have any doubt or comment about this preliminary review of the flow chart.
No, sir, no doubts.
Okay. Okay. Another important point that we have already mentioned in our previous email is the system manual that is available in the electronic version directly from the system. So in any moment you can check this information, and also you can send an email to me, and also to Liana and Gino, the other person from CREP that are very, very involved in this trial. So any doubt, please let us know by email in order to help you. Continue with the use of the Kamolo system. As you know, as usually, Kamolo system use restricted the access for the use based on a valid user and password. For this particular training, we will use a testing user and password that also you can use in any moment, and you can play with the system as you want, using testing as username and password, and entering the system in order to use it. Then, when the site started to the enrollment, each of you will receive an official credential with username and password in order to be used with real participants. But you can also use in any moment this testing credential. As soon as you enter in the system, a basic summary report is visualizing in the system, indicating the number of participants screening, the number of eligible governments, and set of basic indicators about the progress of the study. In the particular case that you have different access for different hospital, this information will be stratified by hospital, but as far as we know, in your case, each of you will be involved only with one of the hospital. And also, in the data quality indicator tab, you will also visualize another set of indicator in order to know about the progress of the data management process, with the number of participants with at least one data inconsistency, number of missing forms, number of pending codification. As you can see, this indicator involves different teams that are working in the REACH trial. And the main menu of the system is basically related with some of the important activity in the data management process. The first one is the summary report that we are mentioned before, and then the data entry menu, in which you will be able to enter data, the different worksheet of each participant, and the inconsistency menu, in which you will be able to review and solve the different data inconsistency predefined in the system, and different reports that you can use in order to work on each of the stages in the data management process, and a set of tools that basically is for setup of the system and predefined information already considered in Kamolo system. So continue, starting with the data entry menu. As you can see, there are two different options. One is the new participant, and the other is participant of list. In Kamolo system, when a new participant is entered in Kamolo system, is by the entering of the corresponding screening worksheet. So when you click in new participant option, an empty screen forms or worksheet is available for data entry. So that means that in that moment you will be able to enter a new participant, because the screening worksheet is the first worksheet that should be entered for each of the participants enrolled. As usually, the data entry of component is very common for any kind of this system. There are different options that should be collected based on a predefined list. Another is a different date and time question that you can use using the calendar, and different checkbox information that can be selected each of the option, and then you have double click in order to unselect all of the questions, or all of the options, sorry. And also there are text box in which you can enter different value, and in case that some value are outlier, the system automatically displays some information indicating that the valid range of this question is predefined and you should follow this valid range. So different kind of data validation element that are very common for any kind of system. And then suppose that you can enter this fictitious information, and you can indicate that the interview was in 5 of November, and then the date of consent. Let me enter the correct value here, because the system, okay. And then you suppose that this is the date of consent, and then we can suppose that omit all this information and indicate that the participant was not randomized. And as you can see, that the system also validate in real time the information, blocking some question that cannot be entered in case that the participant is not randomized. So this is another element of data validation in Kamolo system. Also, we can change to randomize yes, and then enter the date of randomization, and the participant ID for this sample is this 19950. And so at the end of the data entry process, you can click in saving, and this information was successfully saved in Kamolo, but the system immediately display different data inconsistency that have detected. Because internally, Kamolo system have a lot of rule, data validation rule. This data validation rule can be intra-worksheet, in which involve question corresponding to one worksheet, but also there are inter-worksheet validation rule that involved questions from different worksheets. So this is the way that Kamolo system display this information with a brief description here about the data inconsistency detection. For instance, the first data inconsistency is time of consent is missing. So clicking in the test, automatically the case is open, and in orange, the system display about the variable involved in the data inconsistency. So in this particular case, we forgot to enter the time of consent. We can suppose this time. And then when data is modified, when you try to click in save button, automatically the system asks for a description and justification of this data changes. This is one of the requirements for this kind of system, that any data changes should be justified. So the data operator should be entered, for instance, data entry mistake indicated that this modification is justified for some mistake during made during data entry process. So then click in save, and the data is again successfully saved in the system, and the system immediately started to recheck all the data inconsistency. As you can see, the data inconsistency mentioned before disappeared from the list because it was solved. It's already solved. So this is the way that Kamolo manage this issue about the data entry validation. In any moment that you save information, the system recheck all the data discrepancy in order to visualize and take into account that internally Kamolo system keep this information about each data inconsistency detected for each of the participants. Do you have questions about this part of the training?
No, sir. It's clear.
Okay. Continue with the next part of the system that, for my personal point of view, is the most important, is the participant list, because there are a lot of information here in the participant list, because for each participant entered in Kamolo system, you will have a lot of information. The first column represents the identification of the screening worksheet, the date of interview, the participant ID. So when one participant appears in the participant list, means that the corresponding screen worksheet is already entered in the system. And then for each other column, as you can see, that appear each of the worksheet considered in our trial. So if the worksheet was entered, was not entered yet, and was entered and already electronic signature was implemented, here is information that appear in each of the columns. For an orange X means that the worksheet was not entered. For a red tick means that the delivery was entered for this participant, but is not already electronic signature implemented. And when the ticks of the number is in green colors, mean that this CRF, this worksheet was already signed electronically. In addition, with this information that is very useful for you, because through the trial duration, you will very common for you will be to use and filter this list. There are information about the files that corresponding to each. Remember that for this trial, you should take a picture to the balance for each of the drive for postpartum blood hemorrhage collected in order to monitor us and ensure that this each of the measurement in the scale was taken. And also you need to upload this picture. Okay, there are two pictures for each of the participants corresponding to the blue drive and the green drive. Another information that appears in the participant list is the data inconsistency detected in the rules column, and the other column related with the double entry is not applicable yet, because remember that for this trial there was a preliminary stage, the security stage of the trial, in which an additional worksheet were used for data collection, but currently this stage have finalized, and this CRF, the ECG CRF worksheet is not used yet. The other column is the alerts, in which all the monitoring alerts corresponding to the source document verification will be appear information about pending monitoring alert to be solved by you or by the CRO team. And finally, the two columns are related with the PDF, the possibility to generate a unique PDF with all the snapshot of the data entry screen corresponding to each of the worksheets together in one CRF as part of a study documentation. It's a kind of a picture of the data entered in Kamolo. And finally, the log column in order to indicate if the participant is logged or not. The meaning of log is that the data cannot be modified, okay, and all the data elements are blocked, and this is the final data to be analyzed for the paper. Another functionality, important functionality of this participant list is the possibility to filter. Here, clicking in the magnifier, you will be able to use different criteria based on each of the column. For instance, if you filter and visualize data corresponding to the participant that we have entered a few minutes ago, you can enter in participant ID 9950, press enter, and automatically only this participant will be visualized in the participant list. Questions?
Sir, can you explain ECG double entry like that?
Sorry?
ECG.
Okay, fantastic. I am happy to listen this comment. Yeah, it's a good point that you have already experienced and in Kamolo system by the use of the version for action trial 3. So this is a very, very important issue. Continue with the data entry. As you can see, we only enter the screening worksheet, but there are more worksheets that should be entered. So the rest of the worksheet will be entered through the CRF suggestor. Here, when you enter in a particular participant, Kamolo system will offer a new CRF, well, in our case, it's a new worksheet, and offer different worksheet that can be entered based on a predefined rules in order to, for instance, when firstly a screening worksheet is entered, and then you will be able to enter the delivery or the medication or the adverse event, serious adverse event, or discharge worksheet. When you enter then delivery, the system, you will be able to enter the follow-up worksheet. So there are predefined rules in order to guide to the operator about which data can be entered or should be entered. Okay? So in this particular case, we can suppose that delivery worksheet should be entered. So clicking in Dell, automatically a new delivery worksheet is open and empty, ready for data entry. And as you can see, the identification of the case is already entered because the system takes the data from the screening and generate a new worksheet, delivery worksheet ready for enter. Maternal age, we can enter, for instance, 34, gestational age. Suppose that we enter a outlier, we can outlier of the gestational age, the system alerts about this outlier value, but in this particular case, suppose that the real gestational age is 47, you have the possibility to accept this value as value and continue with the data entry. And then again, some skip pattern, you enter 0 in number of period of birth, or if you enter here, now here automatically the system block the variable that are not necessary to be entered because the human have no labor indication, so it's not necessary to enter the induction method. So this is the same criteria that you already know in action 3 in order to enter the data. Okay, and at the end, clicking in Save button, and again the same mechanism. The data are successfully saved, but all these or any data discrepancy is detected, is visualized by the system. Okay. Continue with it. Continue with this part of the system that in general we call the booklet. You can see each of the CRF, each of the worksheet already entered in the system, and also there are a set of additional information. For instance, you can check the data inconsistencies, and the system visualize for each of the worksheet already entered all the pending data inconsistency to be solved. Okay? And also you have the audit trail part of the system that collect information about you can visualize all the data modification for this particular participant. When the data, the new CRF was entered, the screening, this is identification, okay, and this is the person, the user that entered in that moment, enter a new CRF, and then the data modification of the screening in question time of consent was done by testing user in this moment with this justification. The system keep any data modification in order to be in agreement with some regulatory request for this kind of system. Practically identical to the action trial system. To finalize with the data entry part of the system, as you can see here, appear the image tab. In the image tab is the image repository that is the part of the system in which you will be able to upload the images related with the picture from the scale. Okay, so here you can click in the plus symbol, and this indicate if this is the blue or the screen drive. Okay, and then you can choose from your computer different images in order to facilitate the images that you are select. Okay, so here you can select the images and select it automatically. Here you can, for instance, this is one picture, my picture. And then when the image is selected, you can add, clicking add button, and automatically here the one of the picture corresponding to the scale is already uploaded in the system. Okay, this is basically how the data entry process is implemented in Kamolo. Do you have any doubt or comment?
No, sir.
Okay. So continue with the data inconsistency menu. As we already visualized before, for one particular participant, you will be able to visualize the data inconsistency for corresponding to this participant. But if you want to review the general situation of the data inconsistency, you have here two different alternatives. You can visualize all the data inconsistency by rule. For each predefined rule in the system, you will know how many participants are violated the rule. Here, for each rule defined in the system, you will be able to know how many cases are violated this rule. Okay? For instance, how many date onset missing in R are 3 cases. And which are these cases? Clicking in the magnifier, you will be able to visualize exactly who participants are involved with this data discrepancy. So this is the 3 participants, this is the participant ID, but also you can click in open, for instance, in the first one, and automatically the system open the corresponding adverse event worksheet and highlight it in orange the variable involved with the data discrepancy or data inconsistency in order to facilitate your work. Remember one important rule in relation to the data modification. For each trial, the source document are the corresponding worksheet. So any data modification should be implemented in the hard copy of the worksheet and also in Kamolo system in order to be sure that both data are identical, because remember that practically at the end of the data management process, the famous source document verification will be implemented by the CRO in order to, and one of the activity of the source document verification is the data comparison between source document, the worksheet, and Kamolo system data. So it's very important to ensure this standard that any data modification should be implemented in both parts. Okay. The other reports related with the data discrepancy or data inconsistency is by participants. This the same set of data discrepancy are visualized in another way. You will be able to visualize all together for one participant. For instance, the first two rows are corresponding to participant ID 9100. Both data inconsistency are in a screening worksheet, and this is the problem. The other rows, all of them are corresponding to participant ID 9001 in medication, in a screen, and also here the last one is related with is the inter worksheet data discrepancy between a screening and delivery. So this is the same information, but visualizing in different way. In this part of the system, in this report, you will be able to export the information in an Excel file and also filter information. For instance, we can filter this the ID, the participant ID 9001, and only you will be able to visualize in the report the participant that you are filtered the list. So another way, our recommendation is that periodically your team visualize this report in order to know how many and which data problems are pending to solve. As you have already know from action trial, Liana and Gino are in contact communication with you by email, request different data discrepancy or data problem detected. So one mechanism to prevent that Liana and Gino send this email is that you yourself periodically, one time a week, for instance, more considering the number of recruitment, expected number of participants enrolled by month, you yourself review this report and solve the data problem in advance to the Gino and Liana email. Anyway, Gino and Liana will be in contact with you, as you already know. Send any email in case of any doubt or also data problem that we have detected from our side. Okay, questions, doubt?
Sir, can you enter both eligible and ineligible cases?
In this study, will be only enter the eligible participant. Okay, because as you can see there will be a kind of pre-screening in order to establish this eligibility criteria. So in Kamolo system only will be entered the eligible participant. The reason of this decision is that the number of non-eligible participants can be very big in any of our hospitals, and the data entry and data process for those participants can be difficult to manage for each of the hospital, because as you know, the prevalence of the postpartum hemorrhage is not a big number. So we can imagine that if we enter all the screening, practically we'll spend more time and a lot of resources to enter the non-eligible participant, and this is and And this is an unpractical issue for our trial. Okay?
Okay, sir.
Okay. Continue with the last part of the training. The report menu. I would like to focus on in one of these, one or two. The most important is the missing form, because it's you know that the data is entered, that some data can be missing, okay, and then appear some data in the system automatically detect the missing value in one question. But what happens if you forgot or you have no information about a complete worksheet for some reason, or you forgot, the data operator forgot to enter one of the complete worksheets? So this information will not appear in the data inconsistency report, because the data inconsistency requests that the worksheet is entered in Kamolo. And in this case, the worksheet is not entered in Kamolo. So that's why we recommend the use of missing form reports in order to know for each of the worksheets of the study, to know which participant has pending to enter the corresponding worksheet, okay? The follow-up missing. What is the follow-up missing form? This is the participant that you need to focus on to enter and recover this information. So obviously that we are in front of fictitious data, so that's why there are a lot of missing form. But let me confirm and ensure that this is a very useful report in order to detect some data entry omission or maybe some identification mistake with one of the worksheets that you complete the delivery or the follow-up worksheet using the identification for another, and then the system automatically will detect some duplication, but also the system will ask for the remaining follow-up or delivery form that has not entered yet. So this is a very important report that we strongly recommend to review periodically. And the other report that we recommend is the source document verification. And before to review this report, let me comment how source document verification is implemented in Kamolo. We can go to the system manual, and here in the point 4.1, the monitoring alert title is about the source document verification, and the most important definition of concept in Kamolo is that source document verification is implemented through monitoring alerts. And the monitoring alerts are three kinds of monitoring alerts. The unsolved status that is considered is represented in red color, that are some problem detected by the monitor, the CRO, in relation to the source document verification. And the other status is reviewed by PI, represented by the yellow color, in which this error detected by the CRO was already considered by the hospital staff and PI, and some proposal solution were already done, and this monitoring alert is ready to solve finally by the monitor. That is the confirmation by the CRO that the solution implemented by the PI is okay. So this kind of status is a kind of pass the ball in the soccer, because the CRO pass the ball to the PI, indicating, okay, there are some problems that you need to solve in terms of the source document verification, and then the PI review the data, solve the situation, and pass the ball to the CRO in order to indicate, okay, this is the proposal solution, and then finally the CRO take the ball and review all the situation, and finally change the color of the alert to green in order to indicate that everything's okay in relation to the corresponding problem. Okay, this is an important concept to be considered. And also, in general, you will be involved with the different kind of monitoring alert, but in general, you will involved with the source document verification alerts, okay? Because then for another part of the data management process is the codification, that also is implemented by us together with another team in Argentina that are in charge of the MEDRA and who decode this. But it should be sure that from your side, you will be only involved with the source document verification kind of alerts. Okay, another concept that all randomized participants will be source document verified at the, so all the participants randomized in the system will be verified in terms of source document verification, and only a set of questions in the worksheet will be audited. Not all the questions. For each of the worksheets, the system, in agreement with the CRO, have established which question should be verified. Okay? So, in order to visualize how source document verification should be carried out, we can go to the participant list, and then we can view all the CRA, all the cases, and then we can filter the participant 9900, okay? And here, as you can see, in the alerts column, there are different alerts to be pending to solve. Pending to solve is in alert is in red or in yellow color. So you should open the participant and go to the delivery that have a lot of red alerts, but also in the adverse event number 2, you have one of these in red color. Okay, that means that you should verify something. Clicking with the right button of the mouse, this small screen is open, indicating that some red color alert is in Kamolo, and the data in the worksheet doesn't match with the Kamolo data. So the data that appear in the worksheet, in the hard copy, is not identical to the data that appear in Kamolo for question. Air date is the date of the onset corresponding to the adverse event worksheet. Okay? So what the action that we need to know? Obviously, you need to verify the data in the worksheet and then check why the data is different. Okay? And then you need to do the correction in the hard copy forms or in the system, depending on the situation that you have verified. And suppose that for these cases, the data was entered by mistake. So there was a typo error. The data operator entered another value that appeared in the hard copy form. So the action that you need to implement in Kamolo is open this special windows by clicking with the right button of the mouse in the question painting as red, and then click it in edit here in the corresponding alerts in red. Change the status to review by PA, click in saving. That means that the status now is in yellow. As you can see now, is in yellow painted the question, and then modify the data. Suppose that the data was now. Okay? We can 1 on May, we can enter. Okay? And then justify the data modification as usually. Okay. We can enter change due to source document verification and click it in save button in order to modify the data. So with this action, you pass the ball to the CRO, indicating, okay, you have detected your problem in question 4 of adverse event of this participant. Now we propose the solution, and now the CRO should be verified that the solution proposal by you is okay, and finally the CRO will be in charge of change the status at the green color in order to finalize with this. This information about which pending monitoring alert are available in the system is easy to obtain from the participant list here, reviewing here the alerts. For instance, one easy mechanism is we can visualize all participants and then click in the magnifier in order to filter the list. And here in alerts, you can enter a parenthesis and enter. And automatically, all cases in which alert column appear, the parentheses appear. Also, this is the list of cases that in some part of the worksheet, there are some monitoring alert pending to solve. And the other way to obtain more formal listing is by the source document verification report that we have mentioned before. Okay? Here, in addition with this information about the progress of the source document verification, you will be able to click in here and solve source document verification. This is the list of alerts that you can generate by a few clicks in order to know here for each of the participants, okay, what is the question involved and what is the description of the alert that we need to solve, okay? As you can see, the source document verification is a big task, but from your point of view, the action in the system is very basically and using a few clicks you can carry out the source document verification in order to know in each of the site visit by the CRO to know, okay, what is the problem detected in the source document verification and what are the needed action from your side that you need to carry out. Questions about the source document verification?
No questions.
Yeah? No question. Okay. Okay. So this is the all the functionality of the system that you will be used in normally. So any doubt or any issue, please contact to Gino, Liana, and me. I am sure that it's a good point that you have already know Kamolo system through the action trial version, but as you can see, it's practically identical with some improvement. But it's very important for us to know from you any issue or doubt, and remember that you can use this testing part of the system in order to play with the system as you want, with obviously with fictitious data. I will send by email later the recording of this meeting in order to, in case that you need to review. And thank you for your time.
Thank you, sir.
Thank you so much, sir.
Okay, thank you, Tim. We keep in
Yeah,
touch.
Daniel, thank you for
Yeah.
the training. There's one thing, further to this call, our data manager, Mr. Pawan, would be sharing the list of the staff who would be needing the access to the Kamolo database from this Hubballi
really?
site. Yeah.
Oh, really? Yeah. You can send an email. This is one important point that I forgot to comment. As in action trial system, we are in charge of creation of the user and disseminate through the private email the corresponding username. One of the differences with version in action trial is that we will send a user names and a temporary password, and in the first login in the system, each of the user will select and enter the final password to be used in the future. So there are some private issue about the password that we can improve in this version of Kamolo in order that each of the user can establish yourself the final password.
Yeah, Daniel, thank you. I think Pawan would be sharing the list of people who would be needing access along with
Exactly.
their details and their role and their email IDs that has to be shared.
Yeah, it's the names and the email and the role. Exactly.
Yeah.
Yeah, sure.
Okay.
Thank you,
Any
Daniel.
question?
Nothing from my side, Daniel.
Okay, thank you, Tim. It's a pleasure work with you again, and we keep in touch. Remember, any doubt or issue, send an email in order to help. There are only one problem, that is the time difference is our country, but I am sure that we'll be in contact.
Yeah, we are really thankful for you to conduct the training at such an early hours for you.
Okay.
Thank you.
Thank you, sir.
Bye. I'm so sorry, but I have another meeting now.
Yeah.
Okay.
Thank you, sir.
Thank you. Bye.
I see better can happen.